Hello, good day. This is Edwin Palero. I'm here at the CSA Medical Aesthetic. I have a follow-up on my jawline neck today, and hopefully it'll be better, be younger, 25 years younger. Well, the last procedures was to take out the turtleneck, and which she accomplished doing that, and now she's gonna follow up on the jawline this way. Don't forget to subscribe at the CSA YouTube channel.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up for our special guest, Sir Ed Palero. Belated! Belated happy birthday! 27th? The reverse. Okay. So about almost 6 months ago, we did a procedure for Sir Ed, so-called cog thread lifting. We focused on the neck region. So today is the follow-up. We need to check now what happened to those scaffold threads, even the PCL booster, and also some of the Platysma band toxin injections. So I'm still amazed at how wonderful the results are. Right, Sir Ed?
Yes, ma'am.
So, how are you po these past months? And like friends, family noticed something?
Yes.
What were they saying?
What's my secret?
What's your secret? So everybody's asking, what's the secret of Edong Badong? And of course, you know, what's the secret already, right? So with the PDO thread lifting, the goal is to restore the collagen buildup, also strengthen and make the skin firm again. Because as time passes by, you know, the aging process, it will make the skin lose the collagen, all the fibrous proteins, elastins, and other extracellular matrix components there. Making the skin, yan, nagsasag, wala na yung firmness, wala na yung tightness, and particularly the neck area. So, we should not forget the neck. It's not only working on the face but also on the neck. Then you will see some lines here, yung mga tinatawag na turkey neck, and then some transverse wrinkles there, and the skin becomes dry or dehydrated, or the skin becomes so loose, so kind of saggy there, and no more firmness, no more tightness. So with our PDO, these are polymers that will stimulate collagen production and will restore that tightness and firmness. For today, it's like a booster treatment for Sir Ed. Yan. So apart from follow-up, we wanna boost what we have done the previous like almost 6 months ago. So we wanna maintain, we wanna sustain. And Sir Ed is so busy in flying and traveling. Yan, maraming travel, sir, right?
Yes, thank you.
Yeah, this is the best time to be doing your, like, you know, exploring the world and different regions, different beautiful places. And that beautiful look, handsome look, young look, beautiful look, right? That's the goal?
That's the
So,
goal.
what kind of treatment, what procedure, we'll show you when we return. And we're back. So, we're with Sir Ed. So, this is just a booster of what we've done like about 6 months ago. So I'll be working on the mid-face, lower face, and also the neck region. So for this part here, we already see tightness and firmness. It's really a big improvement already. And Sir Ed has this good OG curve plus a good jawline already. So we'll just be further boosting this outer aspect of the face. So I'll make my markings first. So for my booster, I will still be using COG PDO threads, and I'll just be using those spiral 60mm. So I'll be making a line again here. I'm just gonna be working on this outer or angle of this mandible part here, and I'll be making a line, so a vertical and horizontal. So one here and then another one here. We'll be doing 2 of those spiral COG, and then we'll be doing this kind of like parallel lines here. Okay, just to improve more this part here. Now I'll just be helping again this part of the neck here. We just want to pull this part. So I'll be having a kind of entry point here, and again I'll have the so-called fanning technique of my thread. So let me start with applying the pain freeze again. So we have a lidocaine, like it's a freezing anesthesia here. So we'll just be spraying on that one, and then after that I'll be injecting my lidocaine as well. So a while ago, they already cleansed the skin, they applied numbing cream, and right now I'm doing my pain freeze, and at the same time I'll be still working on with my lidocaine injectable here. So again, we want to work further on this jawline here, on this outer area. Okay, so Sir Ed, it's just a tiny prick like a lidocaine here. So we've been doing this for Sir Ed a couple of times, so kind of becoming immune to this injection already. So I'll be doing an L shape to improve and lift further this outer part here. So Sir Ed had some travelings, right, sir? Been traveling, celebrated his birthday, and then spending time with family and friends, and then some of his relatives are noticing he's looking younger and younger. They keep on asking him, what have you been doing? So at least this kind of treatments, we're seeing good results and good outcome. So it's nice to do the procedure like you gradually, for example, in one treatment, do this first, do that, okay? Then combine it with your other treatment modalities. Actually, you can also benefit from doing, for example, your devices like your Ultera to make the result really the best result. So you can do combination procedures. Sir Ed is also like doing injections of botulinum toxin for the treatment of your wrinkles, your lines. So those are things that we need to maintain as well. Plus his skincare. He's really good in doing his skincare. He's doing some facial treatments at CSA. So he spends time here for some procedures as well. So I'll be working on this mandibular area here. So I'm just gonna be gliding this part. Now the PDO threads, they have been reported to do a so-called like 20 to 25% reduction in these superficial fat pads here. So for those who want to also kind of reduce a bit their fatty tissues, you can have this done. Okay, some second one. So it's just gonna be parallel here. I'm doing just the 4 lines. So we want to also achieve a so-called masculine face. Masculine and kind of like a well-defined face and younger face and contoured face. Plus we want to target also those loose tissues, loose skin. Okay, so we'll just glide here. Okay. Now I also have a treatment or other so-called other type of thread, the multiple bidirectional thread, because this one is spiral. I'll be combining with the so-called multiple bidirectional. So it contains those short bidirectional kinds of threads, and that one is really strong in terms of fixating or stabilizing your saggy tissues. Okay, so we'll be doing a reverse method here. So I'll be using the same entry point. I'll be using the multiple bidirectional ones. So this one balances the tension on the thread so that there's equal dispersion of those tension, okay? And then I'll have another one here. So to further lift, I'll have another entry point here. Okay. So this is the reverse one, whereby your vector is on the opposite direction. So I'm just gonna lift up to the temple there. Then we'll give one more here. Give me one more here. So this is like a modified kind of like approach. So the patterns are kind of like modified. So if you want to give a more masculine look, so this is a pattern that you can also apply. So I'm just cutting off. So let's do the neck area. So it's a combination, mid face, lower face. Then let's do the neck. So lidocaine. So I'm just gonna be injecting my anesthesia here. So it's also best to combine your procedures with those polymers that can activate more fibroblast cells. So you can combine with your boosters, with your collagen biostimulators. So this one is being placed, like for example, deep subcutaneous, and you wanna also place a material on top, like your subdermis or hypodermis, or your deep dermis. You can combine with Colshine, you can do your Reduran, you can also use other polymers like Juvilook. You can use other collagen biostimulators, and even your Kaha and other materials you can also combine. So a while ago I've mentioned about still doing like the Platysma Botox to get rid of the so-called Platysma band. Okay, so we'll just finish up with this part here, then we'll just cut off, and then we'll proceed to the opposite side. So we will now proceed with the so-called Platysma tox. We'll be relaxing those Platysma muscles here so they won't be pulling down the lower third of the face, and we want to get rid of the so-called neck bands here. So just inject in the Platysma muscle there, just a few of this, and then the other side here, so you can palpate actually. And just a little bit there, so-called Nefertiti lift, Platysma tox, or the neck band, the Platysma band. And this will also help in tightening, firming the area. Okay, we're done. We're done with the cog thread lifting as well as the Platysma band treatment. We'll show the result when we return. And we're back, so let's show the result to Sir Ed. Sir Ed, here's our mirror again, and you can inspect like what we did, some of the mid face, the lower face, and also the upper neck area. And our goal is to rejuvenate Sir Ed from, like, you know, young to younger to younger and to younger. Yes. That's the goal. We want to kind of as much as possible, freeze the look of a youthful face
Very
with
nice.
our non-surgical approach. How are you, Sir Ed? Are you okay?
Feels good.
Feels good, right?
Yeah.
And
Look younger.
right. So we've been doing like series of treatments, procedures to like highlight those parts of the face that we want to put an emphasis on, like particularly the jawline. Bring out that good contour of the jaw, a masculine jawline for Sir Ed.
I can feel it.
Right.
All
so
my
there's
skin's got stretched out.
yeah, there's tightening already, there's lifting already, plus these threads, they still continue to work. The previous ones that we've inserted, like about 6 months ago, they are still there. Actually, when I was doing the treatment, I still have this kind of like the resistance. We know there's like buildup of fibrous tissues. They're still working, they're still taking effect. Because the PDO, they last about 12 months, but the collagen stimulation is longer lasting. So over time, you'll still see more improvement. So this is kind of like a reversal of aging. So you are also regenerating. You're kind of restoring those collagen elastin that were lost. As we age, there is a decrease in all these extracellular matrix proteins. So we want to restore them, we want to regenerate them, and improve the looks.
Yes.
Yeah. So at the age of like a 72, ayan, si Sir Ed,
72.
nobody believes him na he's 72.
Yeah.
Yan. So we've met people who are in their 70s. We know how they look. Kasi I also had guested a 74-year-old female. Talagang, but we've done the procedure din sa kanya for the first time. So, at least si Sir kasi started early. Yun ang secret. Start treatment earlier. Don't wait for a lot of lines, wrinkles, fixed wrinkles to happen. So, pagka nag-invest ka na earlier, you reap it now. So, si Sir Ed kasi
This
like...
is the result.
This is the result. We've been doing more than 10 years, right?
Yeah.
Oh.
Yeah.
So, yun. Invest on your health, invest on your look, and look at Sir Ed ngayon.
Very nice.
Right?
Yeah.
Thank you so much for
you.
trusting us as well. Yan.
Thank you.
Regular naman bang umuwi from the US eh, parang twice a year. So whenever they come home to the Philippines, they drop by at CSA.
Yes.
Yeah.
Get
so,
refreshed.
Get refreshed. So it's still natural result, still, you know, within the appropriate look, appropriate age. It's not naman na I'm 70, yung extreme na. It's just like looking at your very best version.
Yes.
Yan. And confident and at the same time, happy.
Just like wine.
Yes, like wine. Yan. Thank you so much, Sir Ed.
Thank you so
Saka
much.
ba nila pwedeng i-follow para monitor nila yung improvement?
Sa CSA.
Yung iyong social media.
Social media. Edong Badong.
Yan. You can check him at that social media. Instagram? Facebook?
Facebook,
right? Yan.
Instagram.
Right.
And YouTube.
Yeah. And do you have any message to them?
Yes. If you start early,
Right.
which I started, and little by little, it will increase your youthfulness
Correct.
and
Yeah.
stay young.
Stay young. Okay.
Yeah,
Right.
forever young.
Forever young. That's the goal. Yeah. Thank you so much, Sir Ed. If you have any questions, you may email us at csaskinclinic@yahoo.com. Our FB page, CSA Medical Aesthetics. Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917504468. Yan. Abangan nyo po yung mga maraming episodes. Si Sir Den, yung mga previous episodes niya, even like 10 years ago, right?
Yes, we started in the oak.
Yes. So, check on our YouTube channel, Contessa Salvador, and our website, csamedicalaesthetics.com. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.